The exploratory analysis conducted by Seymour and colleagues of the GALLIUM study specifically looked at patients who progressed within 24 months of studying therapy on study. What they have found is that patients who were enrolled on obinutuzumab chemotherapy arm actually had lower risk of developing early progressive disease compared to patients who were enrolled on rituximab chemotherapy arm. That hazard ratio was about 0.46, so there was a risk reduction from 17% to roughly 10%, which is quite significant for this patient population. So this is a very tantalizing result, which raises a hypothesis that the combination of obinutuzumab with chemotherapy may somehow lower the risk of early disease progression. That certainly remains an unmet medical need in therapy of follicular lymphoma, and this is very exciting data.
The GALLIUM study randomized patients with follicular lymphoma to obinutuzumab-containing chemotherapy or rituximab-containing chemotherapy. And obinutuzumab is an anti-CD20 antibody. It is very similar to rituximab, but it binds complement less effectively, and it enhances antibody-dependent cytotoxicity. So those are the two differences broadly between rituximab and obinutuzumab. So obinutuzumab has been looked at to see whether it was perhaps better than or more effective than rituximab in this large study. So the study randomized patients to those two arms. The chemotherapy was actually picked by the site, it was a multi-center study, so the chemotherapy of choice was picked by the site in advance, and so with the randomization was the antibody. So that was 6 cycles of the antibody, 6 to 8 cycles of antibody with chemo, and then 2 years of maintenance. So that was a big randomized international study. And the primary endpoint was progression-free survival. The initial results were presented at ASH in 2017 and published in the New England Journal later on. But what the 4-year follow-up from this past ASH showed us is that that was longer follow-up, and essentially the results were sustained. There was an ongoing benefit to obinutuzumab in terms of progression-free survival. The initial study showed a 7% benefit in progression-free survival when using obinutuzumab. So what this study from 2018 showed is that the results were maintained, the progression-free survival benefit still persists, but there is no benefit to overall survival. And given that the follow-up is only 5 years, you're not going to demonstrate a benefit in overall survival in follicular lymphoma with such short follow-up. So I think over time we will know whether or not that ends up providing a survival benefit, but for now we see that there is still a sustained progression-free survival benefit. The interpretation of this is that obinutuzumab seems to somehow affect the natural history of follicular lymphoma, but again, we don't really know why these patients had a decreased number of disease-related events. So I think that remains to be seen.
While it is difficult to consider this data practice changing right now, it is certainly hypothesis-generating data which suggests that maybe patients who are suspect to be early progressors should receive a combination of obinutuzumab and chemotherapy. The problem, of course, is that we never necessarily know who those patients are. As we discussed earlier, there are some predictive factors which potentially could identify those patients for us. However, those factors do not work with certainty. Therefore, applying this data in everyday clinical practice may be somewhat difficult. I would say that patients who present with features which have been associated with high risk of early progressive disease, including those that I've mentioned before, such as high FLIPI score, advanced stage, high LDH, high beta-2 microglobulin, I would strongly consider use of a combination of obinutuzumab and chemotherapy for those patients over rituximab.
I don't think at the current time it impacts my personal decision to treat patients with follicular lymphoma, because obinutuzumab containing chemotherapy and rituximab containing chemotherapy the side effect profile is different. If you have someone that's a little older and whom you are thinking about using bendamustine, obinutuzumab may not be your first choice because that group of patients were more likely to experience toxicity. So I think that the decrease in disease-related events alone would not suffice, in my opinion, to choose one over the other, at least now. That is something that's currently being investigated.